Pelvic organ prolapse occurs when tissue and muscles can no longer support the pelvic organs. This happens when the pelvic organs, like the uterus, bladder, or bowel, collapse into the vagina. Symptoms can come on gradually and may not be noticed at first, but a healthcare professional may discover a prolapse during a physical exam. If you have symptoms and they interfere with normal activities, you may need treatment. The goal of reconstructive surgery is to restore organs to their original position. And to tell us more about all of this is Dr. Keith T. Downing, Chief Female Pelvic Medicine and Reconstructive Surgery for Catholic Health Services. Welcome. It's good to have you here.
Thank you for having me.
I was surprised at that statistic that 25% of female adults in the U.S. actually have this.
Pelvic floor disorders are common problems. You know, we see problems with urinary incontinence, problems with prolapse are very common. And so, yeah, it's one of those things that many women will experience. And depending on the extent of their symptoms, the nature of their symptoms, you know, will determine in terms of how much bother they may have or have not.
Or how much treatment they may need is what you're really saying.
Yeah, exactly.
So what exactly is it?
So the description in the lead-in was excellent. I think of it as a bit like a hernia, right, where the support to the vaginal walls have weakened such that the bladder, the bowels, or the uterus can kind of bulge into the vagina to the opening or perhaps beyond. The analogy I like to use is thinking of the vagina like a room, right? What's happening to the roof, what's happening to the floor, or if you're walking into a room, what's happening to the far wall? Is that roof you know, sagging down and coming to the opening? Is the floor buckling out, or is that far wall coming towards the opening?
Well, so if we're talking about that, you know, that happening, it doesn't always need surgery. I guess actually I should start with what causes it.
Yeah, so the common risk factors are having been pregnant and particularly having vaginal deliveries. And we do think having more deliveries increases one's risk. Aging is another big risk factor.
Oh, great. So you're hitting all the good points here. Okay.
You know, as we get older, our muscles weaken, our tissues become less, lose their strength, and so that contributes as well. When women go through menopause, they lose estrogen. That also affects the tissues and the strength and support the tissues can provide. Women who have conditions that result in increased intra-abdominal pressure, so chronic constipation, it may be something like COPD or emphysema, or it may be the nature of their work where they're doing a lot of heavy lifting over long periods of time. All that can contribute to the onset of prolapse.
Can exercise, too much exercise, cause it?
We don't necessarily think so, too much exercise. Generally, you know, there are a lot of reasons to exercise and exercise regularly, and we don't want to, you know, interfere with that.
Nope, because we like that when people exercise. But how do you really know when you have it? Because you say that, because, you know, the symptoms come on over time.
Right.
And how do you know when you actually need to deal with it?
Right, right. Well, symptoms can range from really being asymptomatic. I have many women who referred to me because they were told by their gynecologist that their bladder was low, that there was some prolapse present, but they didn't really know or notice anything or feel anything themselves. Other women may be having pressure or bulge sensation. They may feel or see something that's there coming out past the opening of the vagina. Some women may begin to have problems with moving their bowels or emptying their bladder or interfering with sexual activity. So the symptoms can range quite a bit.
So once you determine that you have this, though, then what is the treatment?
Right. Well, I think first thing that I want to try to understand when the patient comes to the office is kind of the extent and nature of their prolapse. You know, we talked about the different, you know, the roof of the vagina, the floor of the vagina, and the far wall. So I want to understand kind of what compartments are being affected. You know, 1, 2, or all 3, or some combination thereof. So that's one thing. The other is what impact it's having on their life and on their quality of life. You know, so I think in terms of thinking about what we want to do, the patient themselves is really going to determine that in many ways by the extent of the bother that they're having.
Sure, like how much is it interfering with their normal life? And if it is, then what? Surgery?
Well, so there's a range of options. So one is saying, listen, you know, we can work on strengthening your pelvic floor muscles, and that may not reverse all of the prolapse that's there, but it may help things stay in more so that you are less symptomatic. And for some women, that may be enough, you know. For other women, we can use something called a pessary. Pessaries are devices, most are kind of circular or disc-shaped, that we can place in the vagina, support the prolapse. A pessary has to be big enough to stay in, small enough that a woman shouldn't feel it, which is quite important. And they can use that pessary to manage their prolapse, and they can do that indefinitely. Patients who are using a pessary often come back to the office every 3 months. They don't have to do anything with it. They can leave it be, leave it in place. We'll take it out, clean it, make sure it's not irritating the walls of the vagina. Or certain pessaries a woman can take out and put in on their own, and then they come see us less frequently.
So wait a minute.
Yeah.
So with that, that's something that will you have to have that indefinitely for a long period of time, or how does that work?
Yeah. Women who choose to use a pessary can use it indefinitely, absolutely. Some women, we use it in anticipation of surgery, so they have some relief, but ultimately they want to go on to surgery. Other women will use it for as long as it's working for them.
Mm-hmm. Does it help? Does it help restore anything? No.
Unfortunately, no. No. If you take it out, then you can anticipate the prolapse returning.
Okay. So beyond that,
Yeah.
when you finally decide surgery is necessary.
Right, right. So we have a number of different options of treating prolapse surgically. I think the most important thing is that we can offer minimally invasive ways of treating one's prolapse, and that can be the kind of original minimally invasive surgery, operating through the vagina, or it can be operating laparoscopically, operating through small incisions in the abdomen, 1 to 2 centimeter incisions, and treating one's prolapse that way.
But what do you do?
So usually we're trying to lift and support the walls of the vagina. When we're operating vaginally, we're usually doing that using one's own tissue and suture. When we're operating laparoscopically, we do often use mesh material to help support the walls of the vagina.
So there's mesh that's actually put in?
Yeah, right. So we use mesh material, brought in through our trocars, placed into the abdomen. They're then secured to the walls of the vagina, the anterior wall, the roof, and the posterior wall, the floor of the vagina, with suture. And then with that mesh, we then elevate the vaginal vault, and we can secure it to the tailbone. That keeps things elevated, and that we think is really the most durable way of treating prolapse.
Right. And does that last forever?
One of the challenges of prolapse surgery is no matter kind of who's doing it, where it's getting done, prolapse can potentially recur.
Really?
I think any woman having surgery needs to kind of be aware of that. Now, it doesn't mean it's going to come back to the same extent or the same involved compartment may, prolapse again, but that is something a woman needs to be aware of. But that said, still the majority of women, once treated surgically, are not going to need treatment again.
And when you, I guess, is there any way to prevent it?
We don't have any good ways of preventing it. I mean, if we go back to the primary risk factors, pregnancy and aging, right, these are things that are going to happen to women.
Not going to give up having kids and can't do
Right.
much about that aging thing.
Right. So there's a question always of, if I do enough Kegels, will that prevent the onset of prolapse? Right now we don't have any great way of preventing it from occurring.
But it can't hurt.
Right. Kegels definitely can hurt. We talked about exercise. Exercise for the pelvic floor is doing Kegels, and so you can do those as much as you can, and that should be a benefit and shouldn't cause any harm.